There we go. Good morning, all. Welcome to the May session of the Disabilities and Conditions of Aging Network. I'm pretty sure all of you know we gather monthly on the fourth Wednesday or Thursday of the month to simply connect about what is going on within our different parts of the community, where we can partner, where we can support people with disabilities and conditions of aging. The two are put together because conditions of aging present as disabilities. And with that, I will get us going. I will say I'm probably going to give you guys back at least 10 minutes of your day because I have a appointment right at 11 that I'm going to have to be able to bounce off of this and onto that virtually. So I'm Jeremy Warner with Walking Spirit, as I believe each of you are aware. Walking Spirit over the last couple years has really been refining its business plan and services to where we are offering accessible DEIB consulting and support to really any operation that touches the public sector. Also inspirational public speaking and quality of life, adaptability, and advocacy coaching. And feel free to ask any questions about any of that. My big update is, as I was just saying, we were in Chicago. Walking Spirit was a vendor at the National Restaurant Association show, which really is not a good description of the show because there were people from countries all across the globe, probably at least 50,000 attendees at this event. And I have spent the last 4 or 5 days talking pretty much nonstop from 9 a.m. until usually around 9 p.m. and and as I mentioned, Irena was not thrilled with me for booking Walking Spirit as a vendor at that, as the last day of the show was also our 8th wedding anniversary. But hey, it put us in Chicago, and we had a wonderful time. But the interesting thing was trying to introduce the concept of people with disabilities representing over a quarter of the population to restaurants and architects and design firms and furniture, firms to talk about how they can both from the employment side, reduce turnover costs, spark innovation, increase productivity, elevate their entire team by employing people with disabilities, and from the consumer side to simply increase their market share, reduce their risk, reduce their conflict resolution costs, and all of those things. It makes great business sense to actually be marketing and serving people with disabilities and employing people with disabilities in a way that helps us understand all of that human interaction better and improve those experiences. So that's what I've been doing for the last week and am a bit exhausted. So with that, the big thing I have coming up is at the end of the month doing a presentation to youth workers about how to incorporate accessible DEIB into their work. We believe the actual title of the presentation is, it's been a bit, is it's accessible. Kristen has it because we're co-presenting.
It's super long. Give me one moment.
Right. I believe it was accessible DEIB helping youth workers to make the change or get people in the door, something like that. Sorry, I have not looked at it for over a week.
I haven't either. Hang on one sec.
Yeah.
I just pulled it up yesterday, but it's a lot of words.
It is.
There it is. Empowering youth workers to create accessible DEIB, ensuring everyone gets in the door to make change.
There it is. Thank you.
You're welcome.
Forgive me for not remembering that right off the top of my head.
So many words.
Yeah.
I'm going to put the link to the flyer in the chat because there's a QR code on it to
Very
register.
cool.
Please feel free, everybody, to share this out. And the way we define, sorry, I jumped in, Jeremy. The way we define youth workers is anybody that works with youth in any capacity. So
I was
That's
calling
like
on you next
everybody.
anyways. In regards to the registration for that, so I did a presentation with the Great Lakes ADA Center um, back at the beginning of the month, and folks thought that if they waited till the last minute and just clicked on the link, that they would be able to join. And when they did, registration had closed, I believe, earlier that day. Is that anything that we need to be aware of, telling folks about?
It's all in person. There's not a virtual option.
Okay,
So yeah, at least register by the day before, I would say, because Jennifer needs a food count.
right.
Yeah,
This is where my head is at the moment. Sorry.
you're
I'm
fine.
going on very little sleep. Uh, so anything else you want to fill us in on from Hamilton County?
That was really all I was going to talk about. The only other thing, and I'll put this link in the chat too, is one of the trainings that I do is LGBTQ plus cultural comprehension. And that is the one that throughout this fiscal year, so if you know, like state fiscal years, they go from July to June. So that's the one that throughout this fiscal year, I haven't done as many of. So that's the one I'm really focusing on promoting if anybody wants me to come in June. So I will put a link to, gosh, just email me. And that's for I schedule that for groups. So I don't care if it's like 2 people or 100 people, but I don't like set it up and then have people come. People will say, hey, we want that here at our location. And then I go there.
Okay,
So let me put that in the chat as well. I want to get some of those knocked out in June because I realized yesterday that I haven't done as much of those.
right.
Um, and Jeremy's seen some of my culture slides. So the culture stuff is decent. Like, I think so.
It's fantastic.
I love it.
Absolutely. And yeah, I think that so you do that training on demand for the individual clients, whoever wants you to set those up.
Right. So like Susan Ferguson with accessibility, she set it up with me last fiscal year. So I trained virtually some accessibility folks in that. So that's kind of how it is. Like reach out and say, hey, my group, we have this staff training or we have something coming up. Do you want to come do your presentation? Do you see Freddie Sale? Yeah, there
Yes.
it
And
is.
now that you're
Freddie comes to all videos because he's Freddie.
yes, they're good at that. All right, awesome. Well, since you mentioned accessibility, Sonia, happy birthday. Day late,
Happy
but
birthday.
Thank you. Um, yeah, I always know when Arena and Jeremy's wedding anniversary is because it's always the day before my birthday. Um, so happy anniversary,
thank you.
Jeremy. So what we've got going on at Accessibility, we did hire a new person, so she starts after the Labor Day weekend. We're all excited. And we have coming up, it's the 2024 MHS Independence Indiana Conference. That's in September the 26th and 27th at Embassy Suites, Noblesville Conference Center. So just wanted to kind of put that out, that that's a place that vendors can come and hang out with us Sills Suites or us Sills. And we talk about all disability. So just wanted to put that out there. And I'm not aware of anything else that we've got going on at the moment.
All right, thank you. Allison Weimer, would you like to jump in? I got you in your car again.
Yeah, I just jumped in my car. Sorry. I'm on my
Okay.
way to work. As usual, I am always running late.
Do you want me to bounce
Um,
to somebody else while you're doing your drive?
no, it's fine. I mean,
Okay.
I can do both. Um, if you don't mind, I'm gonna back up though, going down my very steep driveway.
I feel like it's always
Um,
an adventure.
so GCPD has a lot going on right now. Some really exciting things are happening. Can you hear me? I might
Yes.
lose you in a second. Hold on.
Did we lose her? I feel like Allison may be frozen.
Can you guys hear me?
Yes.
Okay, sorry. My internet was switching off. I I have to like get up the road for it to switch off. So GCPD has a lot of really exciting things going on. We have so many things in the works right now. It's really awesome. One of the things that I'm really most excited about is the 5x5 public health workforce internship that we are going to be doing starting in June. It's a 10-week internship. It's a paid internship. We're using our public health workforce dollars to, we hired 5 interns. It was a competitive, extremely competitive process. And these are what the purpose of the project is to better prepare people in the public health sector for understanding, working with, and advocating for people with developmental and intellectual disabilities. So it is, we based it on the 5 social drivers of health. And I just remembered I forgot to take my medicine. I got to turn around and go back and take it. Sorry. So gotta love disability. It's so fun. So anyways, yeah, I'm the lead on this project, and it is so I'm developing the curriculum, but I'm also going to be teaching the course. And we have each week is a different theme. So we're going to be doing all kinds of areas, the correction system, and working with youth, the DD Act, the education system. We're advocacy. We're doing accessibility, equity, and inclusion. I mean, there's so much. It is incredibly intensive. And the interns that we hired are just so fantastic. Some of them are PhD students. All of them are either recent graduates of Masters in Public Health, or they're about to get their Masters in Public Health. And they have a real deep interest for working with people with developmental disabilities. 2 of our interns are from the Freibach Center. And we're really excited about having them as well. They are just amazing. That's increasing our desire to, we want to be a, God, I can't remember what it's called. I'm sorry. It'll come to me. But yeah, so that's going to start in June, and we have some really amazing speakers as well. So we're going to be doing, it's like a class, like Monday, Wednesday, and Friday. We're going to meet as a class and do like collaborative discussions, but also have presenters come and talk about different areas of, you know, what the theme of the week is. And these are directors, state people, partners that we work with. So it's really exciting. I'm really, really excited about it. Yeah, so there's that. And then the next thing that we are doing that is really exciting is the family advocacy project. So we are doing a this I'm not that involved in, but yeah, so that is something else that we just got funding for, and it's a big project. We're going to be doing a lot of events with that, so I can tell you about it, you know, when we meet again, what else we're doing with that. So yeah, that's about it. Somehow I lost my sound. I can't hear you. I'm sorry.
I think he's muted.
Oh,
That's on my end. I muted myself. Okay. So sorry, I was saying that you cut out for just a brief moment there, probably while we were reconnecting to your home Wi-Fi. But I think we caught most of that. If there is anything that I can do to help out with any of that, as always, please let me know. Or if there's anything you want me to send out to the network to make folks aware of what you have going on, I'm always happy to include that as well. So
okay, yeah. I was definitely going to tap you for a couple of things, so I'll email you separately.
wonderful. Look forward to it. All right, so you run and grab your medication,
Thank
and
you.
I will ask Jill Edwards if she'd like to say hello from the Indianapolis Public Library.
Yeah. So I don't get here as much as I would like, but I'm trying. And I do programs for the library system focused for adults. And one of my personal passions is having more accessible programming and things that are supportive. In particular, one of the things that we're looking toward is programming for caregivers. And so thinking about how to do that, where to do that. So our sort of jumping off point is caregiver yoga, some chair yoga. But we know that to do that, we probably need to have concurrent programming for folks who maybe need to bring their people with them if they're a caregiver. And so just thinking through all of the logistics of doing that well. And then beyond that, just making sure that we have programs and opportunities that work for folks. I run our seed libraries as well throughout the system, and so we're at the end of our busy season, but we're always looking for ways to engage folks with meaningful volunteer opportunities, as well as giving them the opportunity to grow their own joy. So
Wonderful, thank you. Anything that you need from us at the moment?
forever insights and suggestions and ideas, in particular for the caregiver programs. We want it to be we're going to ease in that direction. We're going to start with chair yoga and encouraging folks to attend, with the goal that by next year we have kind of a dedicated, but a dedicated program for caregivers. And so to do that, we want it to be in a good location. And we have 25 locations. So coming up with the best one, for example, Fort Bend kind of automatically raises to people's minds as a good library for that, but it's not so far from systems that already exist and have some support. And so maybe we want something more on the south side, etc. So
Absolutely.
if you have groups or suggestions of people that you think might be especially interested in that, I'd love to hear from them, and make sure that we're reflecting the needs and the support that people actually need and not just what we're imposing on them.
Absolutely. And that reminds me, please make certain that your contact info is in the chat, and everybody else, please even though there's only 6 of us today, please make certain that your contact info is in the chat so that I can include that, along with exactly what you were just talking about, anything that we can send to you that could be of any support, like that kind of feedback. So is I will include that when I send out the invite. Again, I think you were on right at the beginning when I was saying that I'm struggling to figure out why it wouldn't send the invite out of the calendar this, for whatever reason, this month. So wound up having to go the email route. But yeah, and also anything that you want me to send out to the network as you have things coming up. I mean, I think you guys saw last month I had a few things with the what's going on with the Medicaid changes and how that's affecting caregivers and things like attendant care. Typically, I try not to hit your email boxes too many times throughout the month, but when it's something that's really affecting the community like that, I think it's very important that we get that out there. So, all right. Michelle Terry, would you like to say hello? I know your camera's not participating. How is your microphone doing?
My mic is working. Good morning, everybody. I am Michelle Terry. I am the Community Engagement Specialist with ChildCare Answers. I don't want to talk too much in detail because I'm going to present next month, and so I want to keep the people wanting more.
Yes.
But we are the Child Care Resource and Referral Agency for Marion, Hendricks, and Hamilton County. And so we do a lot of our service. Of course, our services are free, and they are to help families have access to affordable and quality child care programs that best meet the family's needs, as well as helping them find additional resources, just making those community connections so that we can all assist our families. But one thing that I will definitely be talking about next month is find help. And because one way that we are connecting families to community resources is through the family resource navigation tool, Find Help. But it doesn't work if those programs aren't claiming those cards and aren't verifying those services, because we want to make sure that we are referring families to the correct service that they are wanting. So I do plan on talking more in depth about Find Help and just making sure that all the organizations have claimed their cards, so that we are connecting families to the true resources that they need. And it doesn't hurt to have more than one way for a family to connect with you. And so, yeah, that is just my little spiel for this morning. I'm sorry that my camera's not working, but I have enjoyed this meeting so far.
Thank you. No, that's fine. And thank you for the teaser for next month. So yeah, in June, we're going to have a spotlight from ChildCare Answers about what they have going on there and exactly what Michelle was just talking about in regards to Find Help, how important it is that we're in that database so that they're able to refer folks to us. So, all right. So with that said, we're really
Hey,
only 30
Jeremy,
minutes
if
in.
I could,
Yes,
Jeremy, if I could piggyback on that.
please do.
The Find Help is one of our biggest tools at accessibility.
Yes,
So
ma'am.
yeah, we use that. I use that every single day, 2 to 3 times a day for different consumers. And that's where I send a lot of my resources from. So a big shout out to Find Help.
Oh, yes, it works if you work it, right, Sonia?
Very cool. All right. What I was going to say is we have about 30 minutes left. I did say I wanted to give us at least 10 minutes back because I have an appointment right at 11. Anybody have anything else that they want to talk about? Anything that they want to share? I can tell you with what I was doing all week, I, kept meeting a lot of that resistance of, Jeremy, why should we invest in training and additional accessibility beyond the ADA when nobody's filing a lawsuit against us? And, again, I had to keep going back to, well, the operational benefits of being able to make certain that you're capturing that 25% of the population. And keeping your customers and your employees for as long as possible. So we talked about that a bit. Also, very interesting thing. I think I have shared with you all before that I had an ADA complaint against a Starbucks that their drive-through line cut off the accessible parking. I don't know if any of you remember me talking about that. Basically, the Starbucks that was right outside of my neighborhood was in a strip mall and they got the opportunity to move into an old Boston market, and they renovated the property. They had the right amount of accessible parking spaces. They were right where they needed to be in relation to the main entrance of the building. But when they renovated the property, they rearranged the drive-through line. And whenever more than 4 people were lined up to order, if you had a disability and needed to park in the accessible parking spaces, you couldn't access them. And if you needed to leave, you had to wait until the drive-through line cleared enough for you to leave. So I had been making them aware of that for, multiple times a week since the day they opened at that location, and I saw no change. And it did finally take me having to pursue an ADA complaint to get the attention of somebody above the local level, because the local level didn't seem to care. And without going into any real detail, it really was a very frustrating process, very time consuming. Well, not even time consuming, just dragging on and on and on. And for a person with a disability trying to utilize that civil rights protection to make change, it was very frustrating to myself be on time schedules where I had to reply by a certain date or else the complaint would be dropped and that kind of stuff. And yet their side of it was allowed to drag it out and out and out. But last week, and honestly, where the last time we spoke, it was left with me thinking nothing's ever going to be done. Last week, I stopped by there and they had added a new accessible parking spot across the way from the drive-through line and had painted the striping to get people a path that's very obvious to the curb cut. It was really rather exciting to see the ADA work. So, yeah. So thought I would share that with you guys. That's something to celebrate. Although I still have a slide in my presentations about when you file an ADA complaint, you need to be patient and you need to consider refiling if things continue after the first time you filed. So, but yeah. So there you go. That's what I have to add today. Anybody have anything else they want to throw in, or would you guys like to get a head start on things that you thought you wouldn't see until after 11 o'clock? Okay.
I don't think I have anything else.
All right.
Don't either.
Okay. Very good. Well, thank you all for joining in this month. Enjoy, and I will try to get the invite out to you sooner. Does anybody have anything else that they want me to include with the invite coming up other than the chat and the caption transcript from this? Nope. Okay. Very good. Be well. I will see you in a month. And Kristen, I will see you sooner than that.
I'll see you next week.
Yes, and please reach out if there's anything. I'm hoping to have the presentation to you so you can see it sooner rather than later.
Awesome.
Do you want your slides at the beginning or the end?
I don't know. I'll figure out where to plug them in.
Okay, very good.
Yeah.
Cool.
All right. Awesome.
Thanks.
I look forward to it.
Talk soon.
Bye.
Bye, everybody. Have a good week.
Bye.